Good morning, everybody who's currently joining us. We're just going to wait a minute or two to give other people time to get on and register if they needed to and the like. So we'll just start. We'll start at a couple of minutes past. Okay. Good afternoon, everybody who's joined us today. We will get started. My name's Margaret Hallard. I'm the principal lead of the EC Australia project. And today it's really exciting that I'm able to introduce this seminar. It's part of the ECA seminar series. It's the third of the series. We've got the fourth one next week, focusing on Aboriginal and Torres Strait Islander health and hepatitis C. But for this week, it's our health promotion work that we're really wanting to highlight. It's Your Right. It's the National Hepatitis C Treatment Health Promotion Campaign. There's been some really fabulous work done with communities, which we'll be highlighting today. But before we do that, if we could go to the next slide, please. And I'd like to ask Troy Combo, who's part of the ECA team, to do the acknowledgement of country. Over to you, Troy, please.
Thank you, Margaret. I'd just like to start today by acknowledging traditional owners of the country we meet on today. I'm here in Meanjin in Brisbane on the lands of the Turrbal and the Yarraville people, and just like to welcome everyone from across the country. I know that you're joining us from many different lands, and I'd like to pay my respects to elders past and present and any Aboriginal colleagues that are joining us today. Thank you.
Thanks, Troy. And next slide, please. Now I'd like to ask Shane Kilfoot, and thank you so much, Shane, for the acknowledgement of peers, please.
I'd like to acknowledge and pay my respects to the drug using community and the past, present and future drug users.
Thanks, Shane. Oh, could I go back? Yeah. For those of you who are aware of ECA, you will know that it's very much a partnership. It's been a partnership from the get-go. And one of the first people, when it looked like we might have the opportunity to set up EC Australia, that I rang when I heard that Ramsay might be happy to provide us with what I thought was a significant, and is to this day, a significant amount of money, was Jude Byrne. And I rang Jude to say, Jude, would you please be interested in being part of the ECA partnership? I'd worked with Jude for many, many years. And typical of Jude, she was just super excited and she said yes, and let's get this done. Jude passed away earlier this year. As people, I don't think I need to probably tell this audience that Jude has been an absolute leader and doyen in the field, representing peers and community in all things hepatitis and HIV. I had the pleasure of working with Jude for many, many years on many, many projects. I first met her on a WHO working group where she was fierce in her advocacy, but also really not just a fierce advocate, but she was clear and sharp and to the point and knowledgeable, and all of the things that one admires in somebody when they're trying to get a point across for their community. I just thoroughly enjoyed listening to her and hearing and watching her work and represent the community. The other thing that and as I've said this story before, that I really remember really clearly about Jude was her initial, when the new treatments were coming through and we were talking about the potential for elimination, Jude was skeptical about it, but she invited me to the AIVL AGM to speak. And that's the other thing that I always was really impressed with, is that not everybody is prepared with new information to alter their thinking or change their mind, but Jude was always open to any opportunity that would help the community improve their health and well-being. To me, she's an enormous loss from the sector in Australia, but also globally. As I said, I was on a number of global committees where she is truly lost. But I want to acknowledge Jude, acknowledge her absolute contribution to this health promotion program. This was the critical part of ECA that she was making a major contribution to. And I know Em and I have discussed it, we really miss her voice in this, but I hope that she will be proud of the work that we are progressing on her behalf, amongst other things. But so thank you to Jude for the work that she's done on this, but also I hope that the work we do in the coming 12 months would have made her proud. So thank you. Next slide, please. We've got a big program ahead. I'm not going to read out all of it, but I'm going to simply say thank you to everybody who's participating. Really what we're wanting to showcase is the National Hepatitis C Treatment Health Promotion Campaign, but also over to our first presenter, though, without further ado, over to you, Emily.
Thanks, Margaret. Thanks for the great introduction. All right, so welcome everybody. It's great to have you here today. And today is about showcasing our campaign strategy. And I'd like to highlight 3 key things today. Firstly, I'd like to acknowledge our partners and our reference group who've contributed their time and expertise to shape this campaign. I'd also like to provide an overview of our co-design and peer-led approach, which has really been integral to producing something that would suit the needs of our audience. And lastly, I'd just like to highlight our key campaign strategies that will be rolled out from March next year onwards. So I just wanted to highlight our key aims and objectives that set up this program of work. So we first established the broad aim of co-designing a national peer-led health promotion campaign that will then lead to increased hepatitis C treatment rates in people who inject drugs. And more specifically, we set out the following objectives. We wanted to use a peer-led approach from design through to delivery by working in partnership with peers and AIVL's member organisations. We wanted to use a co-design method to design our campaign and also our evaluation strategy. And lastly, we wanted to appoint a media and advertising agency who could co-produce both our campaign strategy, but also our products alongside us. So we set up a national reference group with key partner organisations and membership that would really enable our peer-led approach. And this reference group has been chaired by myself from EC Australia, alongside and in partnership with AIVL. And as you can see, looking at the slide, you can see our reference group is made up of a great mix of organisations from across Australia. We've got up to 20 members on our reference group, which includes the AIVL National Peer Network members, which has 12 fantastic peers who represent their jurisdiction from across Australia. So this large reference group has really brought along a diverse skill set, and this has really helped us design a unique and quite ambitious campaign that we'd like to roll out next year. And I'd really like to thank the reference group today for their commitment for this piece of work throughout COVID and pandemics and adjusting, and also to working online. And I'd really like to put a special thank you out to Hunter Morgan and Isha Layden, 2 peers from the peer network who've stepped in and taken on larger leadership responsibilities when we lost Jude earlier this year. Next slide, please. So I just wanted to highlight briefly our co-design method because it's a popular method and there's quite a few different variations to it. So I just wanted to highlight and share with you the key principles that we use for the process. So with co-design, everyone in the room is an expert, and the important thing is that power is shared across the group. Co-design also focuses on respect, shared language and empathy. And there's also a big emphasis on shared decision making, which I think worked really well in us developing a national campaign for national reach. And so in using each of these principles, we went beyond consultation and we worked together really to define and identify our problems and to develop our solutions together. Next slide. So the reference group went through 10 workshops and these moved us through the different phases of co-design. And I wanted to note that co-design really asks you to let go of what you think needs to happen right from the start. And you have to put yourself in suspension a little bit to explore all of what you know, what you don't know, and then you evidence check across the different points. So the workshops took us through the different phases of discovery, defining, ideating, prototyping our solutions, and then going to our audience and testing our ideas and solutions. And this is where we tested our ideas with people who currently inject. We had two great agencies who facilitated us through the co-design process, and this included Jess Dart and Shani Rajendra from Clear Horizons. And we also had Jared Pethridge and Jack Mason from the Enigma team, which is our creative agency. And they've been fabulous all the way through in keeping us steady in using this co-design approach. So I just wanted to highlight our audience. More specifically, we'd like to reach people who are currently injecting, and we'd like to reach people who are not accessing hepatitis C treatment and testing services. And we'd like to shift perceptions and support people to prioritise treatment. And so early on in our workshops, we explored who our audience is, and we really recognised that to meet the needs of our audience of people who currently inject, we had to go beyond just an awareness raising campaign by using mainstream media options, and that we'd need multiple components in place that would help support people to feel ready for treatment. And a big part of this was being able to link people to a peer. Next slide, please. So our three core components driving our campaign strategy include reaching as many people in our priority audience as possible with our campaign to raise awareness and to change perceptions about treatment, to connect our audience with peers and trusted treatment services, as they're the most effective at linking people who inject into appropriate treatment. And lastly, we want to resource our peer workforce to engage and guide people through the treatment cascade in collaboration with treatment services. So for the rollout of our campaign next year, we're going to be using a peer-led approach and we'll be working with each of the AIVL member organisations and programs to roll out the campaign. So I just wanted to give a little bit more detail around our aim and our to reach connected resource. The street advertising will be a visual prompt for our audience to think about treatment, and we're going to pair our street advertising with the following activities. We'll have peer outreach engagement activities that will increase conversations about Hep C treatment. We'll have merchandise giveaways to engage and promote our campaign messages. We'll be using financial incentives for the testing and treatment pathway because we know this can re-engage people or either bring new people in for testing and to support people along the treatment pathway. We'll also have an online video series to share personal stories about Hep C treatment. And also a big emphasis will be on localised referrals to peer-led services and related treatment services. So for the rollout next year, this is what it's shaping up to be like. We'll have a staggered launch across each jurisdiction and we're aiming to start in March next year. And this will go through to July 2022. The campaign will run for a 3-month campaign period, and this is where we want to stimulate as much action as possible and as many conversations about Hep C treatment as possible. And so the campaign will be really localised and the hub of activity will be built around what we know about our audience and how we can link them to a peer-led service and a trusted treatment service. We'll also have peer-led engagement strategies, and the use of incentives will be tailored in each area. So we would love your support in running this campaign next year. So if you've got ideas or if you want to know more about our campaign next year, you can please feel free to contact me on the email below, or you can also send an email through to the National Peer Network at AIVL. So that is it for me, and I am going to introduce our next speaker. And Jared, yep, there you are. Great to see you, Jared. Jared is our strategic planner from Enigma, and Enigma is an independent creative agency which focuses on advertising, branding and media. And Jared has been part of our design group all along the way, both in providing advice around behaviour change and media strategies. And Jared's part of the Enigma team who is helping us roll it out next year. So I'll hand over to you, Jared. Thank you.
Yeah, beautiful. Thanks, Emily. So I sort of wanted to start my section because I'm going to talk through the actual the work that we've produced and show you how that looks, and talk about the messaging and the concept itself and how we arrived at that and some of the testing results, which I think are really interesting. But I wanted to start with this slide that talks about our audience, because for me, this goes to the heart of what is so good and brilliant about the co-design process, and what I've really enjoyed about this process personally in working with the peers is this sort of portrait. This came out from one of our earlier workshops where we were really, digging into defining our audience and helping understand. And I mean, to be frank, helping me understand a little bit better, because obviously the peers already knew and had a good understanding of that audience. But this sort of portrait came out, and what I loved about it was how full and rich and positive it was of our audience, And I'll just sort of read through, they're loving, caring, courageous, old school, community spirited, school of hard knocks, breaking cycles and overcoming barriers, unique, two-spirited, sex workers, LGBTQIA+, rough sleepers, people living with a disability, survivors, talented, street smart, First Nations, family, friends, peers, passionate, inspiring, dedicated, living with a positive status, professionals, educated, and my favourite one, powerful. And why I think this is so important is, and speaks so well to the co-design process, frankly, as an advertising agency working on the outside of this, we would have never come up with this view of the audience. And so for me, that was, the real value of it, that I think having this rich understanding of the audience that the co-design process brought allowed us to really, I hope, develop a campaign that will speak and resonate really strongly with the audience, which is the most important thing. So if we go to the next slide. From there, what was really important early on was that because we've got such a large group and working under difficult COVID circumstances, with a lot of workshops hosted online, the initial plan obviously was to do these in person. But it was really important for us to develop a set of criteria and objectives for the campaign itself. And really, these were kind of how we judged our own ideas rather than sort of saying, oh, I like this or I don't. So what are some more objective measures? And this is what we used in the campaign testing, which I'll show you next, to talk through. But really, it's critical that the work stands out. Will a distracted audience notice it? Is it the kind of thing, is the work engaging? Will it make people see it and want to know more almost immediately? Is the message clear and concise? We know we have, a very short time frame with all communications to communicate, so we need that clarity and concision. Will the audience trust the message? And I think as we talk through the audience, and Emily pointed out, a lot of our audience that we're focusing for this campaign haven't been reached, or haven't felt connected with previous campaigns or more mainstream approaches. So there is a lot of distrust. And so, the message feeling like it's coming from a place that our audience can trust was really, really important for this one. And also, crucially, will it actually work? Will it motivate our audience to seek treatment? So we didn't just trust ourselves to answer these questions. We developed some initial concepts, and there were 3 concepts that we put to testing. And the peers did a fantastic job of, taking our survey out into the field and getting the feedback about our audience, and how they respond to the ideas. So if we go to the next slide, I'll just show you one of the pages. This, obviously, we've repeated this for all of the concepts, but for the concept we moved forward with the It's Your Right campaign, This was a series of statements that correlate to those objective measures that we, agreed on early in the campaign. And incredibly, across all of those 6 statements, the level of agreement, when you sum up agree and strongly agree for all of those points, it's above sort of 60% across the board. And this campaign, compared to the other 2, scored the highest in that level of agreement across every single one of those statements compared to the other 2 concepts. So we kind of based on this, and I think I'll sort of draw your attention to the things that I think were really important were, the second from the bottom, the people who made this campaign genuinely want to help. We felt like a 75% level of agreement with that. And above that, the people who made this understand people like me. And so I think, the levels of agreement that we have on those 2 statements and how important they are in the success of this campaign really speaks volumes to the value and benefit of the co-design process. I don't think as an agency standing alone, we would have ever got test results like this on a concept. I think the other thing that I'll just quickly point out here, and it's a testament to the group and that spirit that Emily talked about of sort of leaving preconceived notions at the door. Going into testing, this concept wasn't actually a favourite. There was another concept that I think as a group, we kind of all were a little bit more behind and felt was a potentially better campaign, but the testing results came back so strongly in favour of this one. And it's a credit to the group that we all said, well, no, the results are what the results are, and this is the campaign we'll push through with and move forward with. So that's, I think, a really, really positive result out of that. I'll just get through to the next slide as well. We then asked, comparing the 3 campaigns. One was called Get Sorted, It's Your Right, and another one which was called One Less Thing. And we asked our audience of these campaigns after they'd seen all 3 of them. And I think the wording of this question is crucial as well. It's not, what did you like the best? It is, which did you think would be the most successful at getting people in treatment? And you can see there, the It's Your Right campaign was sort of head and shoulders above the other 2. So it was a clear favourite, which gave us a lot of confidence in the concept. And then if you skip through to the next one, what also gave us a great deal of confidence was when we split out some other priority audiences. So here, looking at in the blue columns, is Aboriginal and Torres Strait Islander audiences. And they also really responded positively to the It's Your Right campaign. And the next slide, sorry, I get thirsty when I talk too much. The It's Your Right, when we're looking at people, living in unstable housing, homeless populations, they also, really gravitated towards the It's Your Right campaign and resonated with that. Over the next slide, there are some sort of verbatim comments out of the research about why people chose that. And I think it paints a really clear picture of, I think there's a lot to learn for future campaigns targeting marginalised audiences as well, in terms of that we can learn from this. The use of colour, how direct and to the point it is. It made me feel like I had a right to get treatment. So it's empowering and it's positive and it's optimistic. It was clearly about Hep C. The bright colours take the negative aspects away. I think a lot of campaigns dealing with serious and difficult concepts tend to sometimes focus too much on the negative aspects and feel a little bit dark and frightening, whereas this is just so positive and uplifting. And when you see the work, it's quite bold. Mention of drug use lets people who inject drugs know that it's talking to them. It's colourful. It looks like band posters, so you'd stop to read it. And some other comments there. So I think, taking that rights-based approach, that bottom comment as well, seems to have really appealed to people because of how empowering and positive and front-footed the campaign concept really is. So I think from here we start actually seeing the concepts themselves. So next slide. So this is kind of the initial concept that we took into testing. So it's not where we've quite finished up, but as you can see here, it's a really bold and assertive campaign about taking control and, this kind of almost feeling of getting one over the man. We're talking to a marginalised audience living under prohibition. And so that feeling of it being quite triumphant, I think, is a real positive of it. It says pretty clearly and concisely, it's possible to find simple judgment-free treatment from people who, as those research results showed us, are 100% on the side of our audience. So from here, we took a lot of the feedback from the research and implemented a lot of refinements and messaging, and really conducted a series of workshops after this with the peer group to refine our messaging. And so that's where we've got some of the posters that we'll use to sort of demonstrate the campaign's concept after here. So on the next slide, these are really where we've ended up. And it's, as you've said, it's a really, really clear, single-minded messaging for each poster that really articulates, first and foremost, there's quite a clear and obvious, sort of call out there in the white circle that, this is about living free of Hep C. And the language that we've used here feels very much like it's coming from inside the community. Get clear while you're on gear. Even really small refinements. We had a version in here that says get clear while you're on the gear. And someone from, I think it was Carol from the peer group, pointed out, no one actually says the gear, we just say gear. And so it's little tiny refinements like that that actually make a huge difference when these posters make their way out into the wild. So these are the posters that sort of would live in sort of out of home areas. And so we've got sort of a generic sort of call to action here where we may or may not be in close proximity to a service that we can direct people to. So we'll be creating a website there, itsyourright.com.au, tying in with the campaign. And that will really be a very simple user interface that helps people find treatment services in their local area by just with a simple lookup. If we go to the next slide, as Emily pointed out, the main objective of this advertising is connecting our audience with the nearest peer-led service. So during the campaign, we've been placing a huge emphasis and working with our media team, we'll be placing these to really localise that call to action down the bottom of the campaign. So that it's really makes it very clear and easy for people who see this messaging and their takeaways that they want to start thinking about testing and treatment. How do we make it as easy as possible to find the right peer-led service? Because we know how important it is connecting with them with an empathetic, caring, like-minded service, that their completion rates through the treatment cascade, if they have that first positive initial experience, really improve. So we'll just sort of click through, and I think I'm coming close to my allotted time. So you can see down here in the bottom of the posters, this is where a lot of that localisation will take place. So this would be one that would be up in Queensland, directing people to the nearest Quinn location, in this instance Bowen Hills, 1 Hamilton Place, but also obviously still keeping the It's Your Right URL so people can sort of still go, and if they're not quite ready to sort of walk in and have a face-to-face conversation, get a little bit more information and feel a little bit more comfortable. If we skip through, these are a series of posters. Oh, if we just go back one, sorry. So again, we can talk here about, fingerprint testing, which is a huge thing that's, really important because of how easy it is, that it's not, talking to the peers, a lot of people, in our audience group avoid testing because, venous access is quite difficult. And so they're worried that if they have to have blood drawn, that's going to be a big ordeal. And so really highlighting things like point of care fingerprint testing is a really important, message for our campaign. Getting clear while you're on gear, as we've talked about, and also simple things, talking about in hindsight, not realizing how bad you'll feel until you're clear. So all of these messages came from that lived experience with the peer group that we've just tried to bring to life as an agency. But here, these are the posters that would be placed up in an NSP or a service where there is a peer available to talk to. So our call to action here, again, tailoring all of that so that we can talk about, get people to start having conversations, is, simply in that NSP environment where there are peers with lived experience and a lot of information and, expertise around Hep C treatment. We just want to get people to start opening up and talking to a peer, whether that's about rapid testing, if that's available in the location that we are, or, more generically about your treatment options. Moving through, this is how we can start using, vinyl stickers on footpaths or stenciling. Again, just with that really clear single-minded messaging on it in each instance. Moving through, sorry if I'm going through, I just want to make sure there's enough time for the group discussion later. Some merchandise. These are t-shirts intended for, people working in NSPs or other services to wear. We were really mindful with merch that, not everyone's going to be comfortable walking around the street wearing something that identifies them as, potentially having Hep C, but we did think that in those services where we want people, directing people to, and where we want to highlight people working in different services or pharmacies or wherever it might be that have expertise around Hep C, how we can call them out and make it obvious that, this is the right person to speak to. Moving on, we had some video content. Oh, I've just got a message from Emily saying that my time's up, but we do intend to shoot some great videos really highlighting that lived experience by the peers that, really I think can sort of speak to that experience. Do we want me to stop now, Emily?
That'd be great, Jared. Look, it's a great overview. Thank you so much. As you can see, we've got a lot of materials being created for our campaign. We will have videos of personal stories about Hep C treatment that can be shared online. We've got merchandise to hand out. So if you're getting excited by this, please contact us and please contact your peer user organisation because they can help disseminate all the merchandise and giveaways that we have. Thanks, Jared. And next up, I would like to hand over to Troy Combo. So Troy is our Program Manager for the EC Australia Aboriginal Health Strategy, and he's based within the Burnett Institute and the University of Queensland School of Public Health. Now, Troy's been part of our reference group for the health promotion campaign, and he is going to highlight and provide an overview of planning for the Aboriginal health promotion campaign activities that will also take place next year. Thanks, Troy.
Thank you, Emily, for the introduction. And it's a real pleasure to be here today to, I guess, give an overview of our plan at EC Australia in regards to rolling out a national Aboriginal and Torres Strait Islander health promotion campaign to increase testing and treatment in the Aboriginal communities. Next slide, please. So EC Australia has an Aboriginal and Torres Strait Islander strategy that informs all of our activities across our key 4 areas. Early on in the development and implementation of Eliminate Hepatitis C Australia partnership, national consultations were done, and it was identified early within them that a 5th pillar or a 5th component needed to be added to the current 4 health promotion, workforce development, implementation, research and evaluation, and that was an Aboriginal and Torres Strait Islander health strategy as well. So we've identified that early within that, a health promotion campaign was prioritised as part of the work that we'll do in completion of EC Australia. Next slide, please. So what we've decided to do is we're currently looking at opportunities for the adaptation of the It's Your Right campaign for Aboriginal and Torres Strait Islander people who inject drugs and who access NSPs and other peer-based services. We know from data from national needle syringe programs that around 1 in 4 or 1 in 5 Aboriginal people people that access NSPs are Aboriginal and Torres Strait Islander people. So we think we would be doing ourselves no justice if we didn't consider this. And we're going to take this back and test it with the peer group within the It's Your Right campaign. The second distinct campaign will be increasing testing and treatment for Aboriginal and Torres Strait Islander people who access Aboriginal community controlled health organisations. EC Australia will have our national leadership group that will provide support and give that cultural oversight, but we'll have another subcommittee that will sit beneath that will drive the development of these resources and the campaign materials. Next slide, please. So campaign 1 is to co-design a national peer-led health promotion campaign that increases hepatitis C treatment who inject drugs, as I've just said. We're looking to engage and appoint an Aboriginal-owned creative and media agency to take some of the already messaging and sort of put an Aboriginal lens and an Aboriginal focus over that, which is sort of what came out within the surveys that Jared had just previously presented. So we want to spend time in the co-design workshops with the group to ensure that the messages are suitable for this population, and look for the right opportunity to integrate this into the rollout of the campaign next year. Next slide, please. So the rationale for this thinking was the high, I guess, participation within the survey. 23% of the survey respondents were Aboriginal and Torres Strait Islander, and we were confident that that aligned with the National Needle Syringe Program participation as well. So we knew that we were getting the right sample of people that were representative of the Aboriginal and Torres Strait Islander community peers. So we're going to take that and further explore it, and we're very confident that we'll be able to have an impact with this messaging of the It's Your Right campaign. I think the It's Your Right campaign resonates with the Aboriginal community as well, being another marginalised and disenfranchised population, and then another subpopulation within our own population. Next slide, please. So campaign 2 will be our health promotion campaign that will be rolled out through Aboriginal community child health organisations. We intend to collaborate with NACCHO on the development of this, and have a steering committee or a reference group that will have positions of NACCHO and their state and territory affiliates. And we'll also invite some local Aboriginal medical service to be part of that reference group too. So the campaign objective is to design a culturally appropriate messaging that is acceptable to the Aboriginal communities, taking into account Aboriginal community child health services service delivery model, knowing that it's a whole of life continuum with a large focus on child and maternal health, and right through the life continuum with chronic disease management as well. So we want to make sure that this messaging is culturally appropriate for within the walls of an Aboriginal community child health service, and that is acceptable, and that it will drive people to treatment. And there's opportunity there to also incorporate the National Hepatitis C helpline as well into that campaign. We're looking to develop it and building on strength-based campaign, building on the communities and the services strengths, and taking, I guess, advice from the sector in what that looks like and how we get that messaging to build on them strengths. Once again, we'll be looking to engage an Aboriginal-owned creative and media agency to develop the campaign, but also the resources, and then engaging with Aboriginal-owned merchandise companies for the development and the rollout of merchandise within that campaign as well. What we are hoping to do, and we'll see what will happen, is that other local health initiatives can hang off this broader campaign within Aboriginal community child medical services, and such things as, increased testing campaigns, liver health months, and that type of thing. And that can sort of be done through the advocacy through NACCHO and the state and territory affiliates into their member services. Next slide. And I think that was it. And I just wanted to give you a quick brief overview of our plan. And we're really excited. And this work is going to start to really rev up towards the end of the year and into early next year. So we look forward to partnering with everyone on this body of work. Thank you.
Thanks so much, Troy. It's really exciting and such an important focus for us to delve into more health promotion activities specifically for the Aboriginal community. So it's an exciting opportunity for us to develop something.
Thank you.
All right. Next up, I'd like to ask the peers and Jackie to pop their cameras on. We have 5 members from the National AIVL Peer Network joining us today. Each of these fabulous members were part of our reference group and design of the campaign. They're also very busy now looking ahead for the plan out of the rollout next year. So I'd like to introduce Carol Holly from South Australia, Isha Layden from Quinn in Brisbane, Peter Sidaway and Shane Kilford coming from Northern Territory, Peter Garver from WA, and we've got Jackie Richmond from the ECA team, who are going to spend some time just having a chat with the peers and talking about what the experience has been like designing the campaign. Thanks, everyone.
Thanks, Emily. And I feel very honoured to be here with the workhorses that are the health promotion campaign. And I think there are lots of questions that have come from the work that we've seen presented. So I'm going to start, Carol, with you. We've heard a lot about co-design. And it as a strategy of building a campaign like this. What was it like being a part of co-design and also being a part of an online co-design, which was not the first approach?
Okay, well, It was certainly a different, very, very new experience. I think using the Trello platform made it go a little bit more smoothly. In some ways, it wasn't so different from the face-to-face, from doing it face-to-face. Like, for example, we did still break out into smaller groups to do small group work, and then, you know, bring that back to the larger group. So, yeah, even though it was online, it still went that way. It was certainly still a peer-led process. So we felt that it was hours from go to woe. And I'll say it was a lot slower, much, much slower. You know, we're still getting there and we're still achieving what we set out to achieve. It's just taking a lot longer. Yeah. But
absolutely. You think about what could be achieved if you were face-to-face in a room for 2 days, and it's now been, what, 20 months where you've all been on a very regular basis. Has anyone else got any reflections on the co-design process and what it's been like doing that online? Shane, aren't you?
Yeah, I think it's been a lot longer. You know, if we had the opportunities to meet face to face, I think we would have got a lot more done. You know, it's difficult when you're working online. People talking over people, not being able to, like, you know, raise your hand and sort of, you know, I'd like to say something now, sort of thing. Whereas, you know, when you're in a group, you know, you can. I think when we did get together there initially, you know, we took the 5-minute break. We'd go down and the smokers would have a cigarette, and we'd talk about, you know, what things we'd been, you know, working on upstairs, and come up with all sorts of ideas while we're down there having a cigarette. So yeah, it has been difficult working online.
Well, you're a very well-oiled machine. I've been very privileged to sit in on some of your recent meetings, and you look like a group of people who've really gotten to know each other very well. Many of you I know already did know each other, but it's been a real credit to you the way you've been able to adapt to this. So Peter, this is the first time that a national campaign has been developed for people who are specifically injecting drugs. What do you hope for the campaign? What do you like about it? What are your aspirations?
well, I've thought from the beginning that if you want to spur people to action, you have to make them feel something. And I feel like the slogan, "It's your right," does that. As injecting drug users, many of us are criminalised and marginalised and stigmatised every day. So as soon as you start talking about rights, my head pops up and I look, you know. I hope that telling people that they have the right to access healthcare in an accessible environment where they can be treated with respect leads people to find the organisations that have the options that they need. And, you know, we would talk about elimination, and I just feel like the only way that we will achieve that is if we can move people to take ownership of their health going forward. And part of doing that is, you know, getting them to take ownership of services like the ones that we're representing. So
fabulous. Anybody else got any, want to share your hopes for the campaign?
I think another thing is that a lot of people who inject drugs out in our community don't really know about our peer-focused harm reduction organisations. So it would be good, you know, for the people that don't know about it come into our organisations and feel like they can be themselves and relax and ask about their health and whatever they want to talk about, instead of like just, you know, staying at home or wherever they're living and dealing with some health issues and feeling like that they can't share their stories or talk about them because of the stigma and discrimination around it. So I think that's one really good thing.
So you're not only raising awareness around hepatitis, awareness about your roles and the resource and your organisations as well, and, you know, that sort of general bringing people together. Any other thoughts?
I feel like anytime you bring all of our organisations, I know that we adapt according to the needs and the feedback of the people that we provide a service to. And so you know, a campaign like this stands to bring a lot of fresh faces to our organisation, which brings a fresh perspective.
Yeah.
New relationships to build. And I feel like that's the most valuable thing.
What a great point, Peter. Yeah, and it really, yeah, those new faces, new perspectives, new experiences. That's a really exciting way of looking at it. Tegan from Quinn has just said, good on you guys, great conversation and thank you for all your work. So making sure that you get that message. Shane, how easy was it to develop a poster for the audience? You know, Jared outlined all the things that this poster had to do. It had to attract people's attention. The message had to mean something. Talk us through that process.
Yeah, I mean, from the get-go, it was a hard process. We needed to get something that that caught people. You know, it was catchy. It needed to somehow be specific to injecting drug users. We needed something that you know, that they wouldn't walk past. You know, that they would read. It needed to have something to do with Hep C and you know, that ownership sort of thing, and you know, destigmatizing language. Yeah, no, it was difficult to put together a poster that encompassed everything and would you know, and would catch a drug user's you know, attention. So yeah. Yeah,
and as you say, you've got the information, but you're also trying to draw them in, aren't you? You're trying to
exactly, yeah,
so that they can meet you and have a conversation with you.
That's right. Yeah.
Introduce
bring them back to us, sort of thing. So, yeah, it had to tell a lot of stories, and you know, just to, you know, the one we've got is "You're Right." It's a fantastic slogan, and it took us a long time to come up with that. Yeah, no, I mean, that's it really sort of draws people in, and it's fantastic that we've you know, discovered that one. But yeah, there was a lot of ones that went by the wayside. So,
and as Jared flagged, sorry Shane, as Jared flagged, this one wasn't necessarily your favourite, was it?
Not straight away, no. No, there was a lot of other ones that came into the picture, yeah, and yeah, we had to, you know, weed them out one by one, and some of the processes that Jared and the team went through, you know, getting us to do polls and that sort of thing, and yeah, you know, I think we were all surprised at the results in the end. You know, what came forward and what didn't come forward, you know. And we all had our favourites, you know. I mean, there was some that we liked more than others, but yeah, no, it came through with shining colours. So.
Yeah, and it goes to Peter's point that you're engaging new people who have fresh ideas, and you know, I take my hat off to you, just like Jared did as well. The fact that you were able to adapt and say, oh, okay, well, that may not have been my favourite, but that's what the people have told us. So that's what we're going to take forward, adaptability as well.
Yeah.
Thank you, Shane. So Pete, you know, you're all working in different peer-led programs around the country and, you know, meeting on a very regular basis, sometimes fortnightly. What have you learnt about other peer approaches from across the country?
Yeah, G'day. Yeah, well, looking at peer-based organisations across Australia that host NSPs with representation in the National Peer Network, the only real difference that I sort of pick up is some specific organisational goals for different organisations. Like, you know, some of us are principally bloodborne virus organisations, but all of us to some degree are drug user rights advocates. All operate under the harm reduction pillar of the National Drug Strategy, and harm reduction is put forward as the central and main tenet of most organisations' operations. There's also a very strong human rights element to all the different organisations that operate NSPs. And peer-based staffing is also a very important central tenet of all the different organisations' operations, which of course the peer staffing enables a very highly enhanced level of engagement with people who inject drugs, mainly because, well, peers have a personal experience of the challenges that people who inject drugs experience every day in their day-to-day lives, and they have personal experience of the stigma and discrimination suffered by people who use drugs. And of course, the often complete denial of our basic human rights, which I think has been a major factor in feeding into that current slogan. And the peers also understand the barriers that are reducing engagement for people who inject drugs into the health system. So it was an interesting one to try and look at the differences, but really don't find much difference between the organisation. There's, you know, always some contentious differences, not necessarily related just to organisations. I mean, even amongst the National Peer Network, we don't always agree on everything. And, you know, so we have some, meetings of the National Peer Network are quite, how do you put it?
Heated.
They're
Heated,
very, very
Shane's
open.
saying heated. Robust.
No, I wouldn't go heated. Just, it's, if there's differences of opinions, you know, people are not fearful of coming out with them. They're very upfront.
Sounds like a
very
healthy
honest.
environment to me.
Oh, it is indeed. And it's, you know, and it's good in a way, like we get our differences and other points of contention out in the National Peer Network meetings, you know, and then we come along to the EC Australia meetings, and because we're all working for the same ends, everybody's on the same, you know, pretty much singing from the same hymn book on the same page.
That's great. That's great.
Shown over the last, however many months.
20 months, 20 long months, Pete. That's great. Anybody else got any reflections on what it's been like working? Because I'm just looking at all of you here. You are all working for sort of slightly different organisations. You know, your roles are, you know, they might be similar, but you all execute them in slightly different ways as well. So anybody got anything they want to add on that?
I will. We in South Australia, in our program, we don't do a lot of outreach. Most of our service provision is through the NSP. So this is going to be something really different and really exciting. And I'm really looking forward to actually doing some outreach and connecting with people that aren't using our services. So I know a lot of the other peer organisations do outreach. We don't currently do a lot of it. So for me, for us, that will be something, really, really exciting to do. Yeah.
Carol, it's a great point that you have the capacity to do something a bit different. I've actually got a question here from the audience about, you know, does your organisation, do all of your organisations have the capacity or the funding to take this work up?
I think thanks to EC Australia, we probably do.
So there is some funding that is associated with this program to support peer-based organisations and the peers to get out and do this work.
Yeah.
It is a very important point that we need to have the resources. Isha.
Yes.
Did you want to comment on the issue about the peer-led programs?
I think one good thing is that we're all from different states, and when we do get together, it's really interesting to see what other states and jurisdictions are doing in their, work roles. And I think from the start till now, we've built like a really good little family, and we've made like heaps of connections. So if there's something like a drug alert happening in Queensland, we can go back to our peer network and see if it's happening somewhere else. And through COVID, I think it was really great because we did still continue with these meetings, and some organisations couldn't work to their capacity. So it was probably building the, our social needs to get together to see what other states and jurisdictions were doing through that hard time.
Yeah, there's always that camaraderie. You know, we feed off each other. So Isha, keep your microphone on. I'm going to ask you just to, all of you, to reflect on this question, because it's our last question, but what are you looking forward to most about implementing the campaign?
I'm really looking forward to, well, I'm in Queensland and we have quite a few offices in Queensland. So I'm really looking forward to going to other offices and reaching out to people that we haven't reached out to before. You know, getting to know, like our clients, getting to know that we do have peers here just like them. So to break down those barriers of coming into an organisation, I'm really stoked about meeting other people. And even though we do a lot of outreach and we do point of care testing, just to get to places where we don't usually go. So, and meeting new people, and meeting new organisations as well, like that will, you know, be on the same bandwagon as us, and trying to reduce the stigma and discrimination for people who inject drugs and have hepatitis C in other organisations, even if it's just changing the nurse's view on people and listening to them when they're getting blood, you know, listening to the client when they have to take blood, or just a doctor, the way they prescribed, or just the way they talk to the client on prescribing the medication, etc. So that's what I'm really looking forward to.
That's great, Isha. And Carol, I think you've already indicated you're really looking forward to getting out there and doing that outreach. Anybody else got something that they're really looking forward to doing? Because I think that was a great.
I'm looking forward the same as Isha to the, you know, the conversations that you have with new injecting drug users, and you know, hopefully helping them get into testing and treatment, and you know, moving along with that. You know, I think it's an exciting campaign, and you know, it's going to be great to finally roll it out and get those conversations happening. So yeah.
Fantastic. Thank you all so much for your time, for all the work you have done, for the endless hours on Zoom that you have all spent. And I'll hand over now to Emily.
Lovely. Thanks so much, Jackie. And thank you to each of the peers who've just shared the conversation. Obviously, we would love to have more time with each other and with you to talk about what the experience has been like. But to finish off today is just really just a snapshot of what we're doing. We will be getting in touch with everybody early next year. But to finish this session, I'd like to hand over to Steph Sanitas, who's the Principal Project Officer with AIVL. And Steph has recently joined AIVL, so this is really lovely that you get to meet her. And she's going to close our webinar session for us today. So thank you so much, Steph.
Thank you, Emily. I'd like to acknowledge the traditional custodians of the various lands we're meeting on here today. I'm on unceded Wurundjeri and Bunurong land, and I pay my respects to elders past and present. I'm here to represent AIVL, the Australian Injecting and Illicit Drug Users League, which is the national peak for the state and territory-based member drug user organisations. While I'm not new to the network, I am new to my role with AIVL, and I wasn't a contributor to this campaign to date. Rather, I'm here to congratulate the National Peer Network, made up of 12 representatives, for their contribution to the EC Australia campaign. And they were led by the legendary and late Jude Byrne, along with the other National Reference Group members, Burnett and other stakeholders. This work by the National Peer Network is one recent example where people who inject and use drugs have shaped the health promotion education available for their peers and improved the public health among the wider community. It's one recent example that adds to the history of peer advocacy for the health rights and human rights of people who use drugs. New treatments get used when people who need the treatment learn about it from people they trust. The contribution of community-led initiatives is too frequently under-recognized for a number of reasons, including the ignorance of those in privileged positions, or paternalism preventing affected community members from getting the opportunity to have a seat at the table from design to delivery, even when the knowledge that's hoping to be gained and the outcome has a direct impact on their lives. or, as is especially the case with illicit drug use, the data, that is the knowledge of peers, is kept hidden due to stigma, discrimination, and criminalization. Too often, people who use drugs have to keep quiet and stay cautious, so the details of your life doesn't become the intel that results in a conviction or another socially constructed harm. We know from the legacy of grassroots advocacy that silence equals death and to act up equals life. We know that nothing about us without us isn't just a nice rhyme. It's a clear direction on how to design better research projects, gather rich data, and make better policy. Now, researchers may want to get published in peer-reviewed journals of high academic standing and have those publications cited by other reputable scholars, but I rate other measures more, like being able to capture a complex health equity issue in a few short phrases or a single line on a well-placed poster or on a t-shirt proudly worn by someone on the front line. Nothing about us without us means researchers making a genuine commitment to empowering community through a co-design process. Now, it seems that's what's been achieved here, and within our lifetime, the elimination of Hep C in Australia may be understood by the simple phrase, "It's your right." I'm sure you agree that that's no small feat. So once again, I'd like to congratulate all stakeholders involved in this campaign and thank the panelists here today for sharing an overview of the contribution of the AIVL National Peer Network, among others. Thank you.
I'm not sure whether this is the end of the seminar, are we stopping, but can I just thank everybody for being involved and commend people to the seminar next week, which is on Aboriginal health and hepatitis C, being chaired by Troy. So thank you everybody for joining us today.